Understanding medullary thyroid cancer. Medullary thyroid cancer, or MTC, is a rare type of thyroid cancer. It accounts for about 3 to 4% of all thyroid cancer cases. It affects the C cells of the thyroid gland, which are responsible for producing certain hormones. These C cells produce a hormone called calcitonin, which helps regulate calcium levels in the blood. Unlike other types of thyroid cancer, MTC is not caused by changes in thyroid hormone levels. Instead, it often arises due to genetic mutations. It is often associated with a genetic predisposition, particularly mutations in the RET proto-oncogene. While treatable, early detection and management are crucial for improving patient outcomes. The earlier the cancer is detected, the better the chances of successful treatment. MTC can be challenging to diagnose in its early stages due to its often subtle symptoms. These symptoms can include a lump in the neck, difficulty swallowing, or changes in voice. These symptoms may be similar to other, more common thyroid conditions, making it difficult to identify MTC without specific tests. This is where calcitonin plays a crucial role. Elevated levels of this hormone can indicate the presence of MTC. Elevated levels of calcitonin in the blood can be an early warning sign of MTC, even before a tumor is detectable by imaging tests. Regular monitoring of calcitonin levels can help in early diagnosis and timely treatment. Calcitonin is a naturally occurring hormone produced by the C cells in the thyroid gland. Its primary function is to regulate calcium levels in the blood. When calcium levels rise, calcitonin is released. It acts on the bones, kidneys, and intestines to lower calcium levels back to normal. This balance is essential for many bodily functions, including nerve and muscle function. In the context of MTC, calcitonin takes on another critical role, a tumor marker. Tumor markers are substances found in the blood, urine, or body tissues that can be elevated in the presence of cancer. They help doctors diagnose cancer, assess the effectiveness of treatment, and monitor for recurrence. Measuring calcitonin levels is a straightforward process involving a simple blood test. This test is often recommended by healthcare providers when there is a suspicion of thyroid issues or other related conditions. A small sample of blood is drawn from a vein, usually in the arm. The procedure is quick and typically causes minimal discomfort. This sample is then sent to a laboratory for analysis. The lab technicians are trained to handle and process the blood samples with utmost care to ensure accurate results. The laboratory measures the amount of calcitonin present in the blood and provides the results in nanograms per milliliter. This measurement helps in assessing the function of the thyroid gland and detecting any abnormalities. The normal range for calcitonin levels can vary slightly depending on the laboratory and the specific test used. It's crucial to compare the results with the reference range provided by the lab. However, in general, levels above 10 nanograms per milliliter are considered elevated and may warrant further investigation. Elevated levels can be an indicator of medullary thyroid carcinoma or other thyroid-related conditions. It's important to note that other factors, such as certain medications or benign thyroid conditions, can also cause a slight increase in calcitonin levels. Therefore, elevated levels do not always indicate a serious condition. Therefore, a comprehensive evaluation, including medical history and other diagnostic tests, is essential for accurate interpretation of the results. This holistic approach ensures that any underlying issues are correctly identified and appropriately managed, providing the best possible care for the patient. Calcitonin's role as a tumor marker is particularly crucial in the diagnosis of MTC. As previously mentioned, MTC can be challenging to diagnose in its early stages based on symptoms alone. This is where calcitonin testing comes in. Elevated calcitonin levels, especially in individuals with a family history of MTC or other endocrine disorders, can be a strong indicator of the disease. In many cases, elevated calcitonin levels may be the first sign of MTC, prompting further investigation with imaging tests such as ultrasound or fine needle aspiration biopsy of the thyroid gland. Early detection is crucial for successful treatment of MTC. The sooner the cancer is diagnosed, the better the chances of removing it completely through surgery. Section 5. Monitoring treatment success, calcitonin levels as a guide. Once a diagnosis of medullary thyroid cancer, or MTC, is established, calcitonin levels become an essential tool for monitoring the effectiveness of treatment. After surgery to remove the thyroid gland, calcitonin levels should drop significantly. If levels remain elevated or rise again after initially declining, it could be a sign that not all of the cancerous tissue was removed or that the cancer has returned. Regular monitoring of calcitonin levels allows doctors to track the disease's progression and adjust treatment plans as needed. This personalized approach to treatment helps ensure the best possible outcomes for patients with MTC. It also provides valuable information about the cancer's behavior, which can guide future treatment decisions. Section 6. Detecting recurrence. The importance of regular calcitonin tests. Even after successful treatment, MTC has the potential to recur. Regular calcitonin testing is crucial for detecting recurrence early, when treatment is most effective. The frequency of these tests will vary depending on the individual patient's risk factors and the stage of the disease at diagnosis. For patients with a high risk of recurrence, more frequent testing may be recommended. This proactive approach to monitoring allows doctors to identify and address any signs of recurrence promptly. It empowers patients to be active participants in their healthcare journey, providing a sense of control and reducing anxiety associated with the possibility of recurrence. Section 7. Calcitonin and genetic testing, predicting risk in families. MTC can sometimes run in families due to inherited genetic mutations. Genetic testing can identify individuals who carry these mutations and are therefore at increased risk of developing the disease. For those who test positive for these mutations, regular calcitonin testing, often starting in childhood, is essential for early detection. In some cases, prophylactic surgery to remove the thyroid gland may even be recommended for individuals with a high genetic risk, even before any signs of cancer are present. This proactive approach aims to prevent the disease from developing altogether. It highlights the importance of understanding family history and considering genetic testing when appropriate. Section 8. Living with medullary thyroid cancer. A long-term perspective. Living with MTC often requires a long-term perspective and commitment to regular monitoring. While the initial diagnosis and treatment phase can be challenging, many people with MTC go on to live long and fulfilling lives. Regular calcitonin testing provides reassurance and allows for timely intervention if the cancer does return. Support groups and online resources can provide valuable information and emotional support for individuals with MTC and their families. Connecting with others who understand the unique challenges of living with this rare cancer can be empowering and foster a sense of community. Section 9. The future of calcitonin in cancer management. Research is ongoing to explore new ways to utilize calcitonin in cancer management. Scientists are investigating its potential as a target for new therapies, particularly for advanced MTC that doesn't respond to traditional treatments. Additionally, researchers are working to develop more sensitive and specific calcitonin tests that can detect even smaller amounts of the hormone in the blood. These advancements hold promise for improving the diagnosis, treatment, and long-term outcomes for individuals with MTC. They underscore the importance of continued research and innovation in the field of cancer care. Section 10. Conclusion. Calcitonin, a vital tool in the fight against medullary thyroid cancer. Calcitonin plays a multifaceted and vital role in the management of medullary thyroid cancer, or MTC. This hormone, produced by the thyroid gland, is not only essential for calcium regulation, but also serves as a crucial biomarker in the fight against this rare form of cancer. As a tumor marker, it aids in early diagnosis, treatment monitoring, and recurrence detection. Elevated levels of calcitonin in the blood can be one of the first indicators of MTC, allowing for timely intervention and better patient outcomes. Its importance cannot be overstated. Calcitonin testing is a cornerstone in the management of MTC, providing invaluable information that guides treatment decisions and helps in assessing the effectiveness of therapies. Regular calcitonin testing, especially for individuals with a family history of MTC or other endocrine disorders, is crucial for detecting the disease early, when treatment is most effective. Genetic counseling and regular screenings can significantly improve the prognosis for those at risk. Through continued research and a commitment to early detection and comprehensive care, we can improve the lives of those affected by MTC and work towards a future where this rare cancer is no longer a threat. Researchers are constantly exploring new ways to enhance the accuracy and efficacy of calcitonin testing, making it an even more powerful tool in cancer management. Calcitonin, a simple hormone with a profound impact, stands as a beacon of hope in this ongoing battle. Its role in early detection and treatment monitoring makes it an indispensable ally in the fight against medullary thyroid cancer, offering hope and a brighter future for patients and their families.